We can now speak to Lindis Hurum, who's the field coordinator for North Kivu at Doctors Without Borders, joining us from Goma. Welcome to Al Jazeera. Just first, tell us about the situation where you are, and also now that the first batch of these vaccines have arrived, how challenging is it going to be in terms of the logistics of getting the vaccines to areas around the country?
Thank you. Yes, so here I'm based in Goma in the Eastern Congo. And right now here where I am, the situation, the Mpox situation is not, we don't have that many cases yet. We have a few confirmed cases and so far no mortality registered. That said, this is a dense population. It's an urban population of close to 2 million. And in addition to that, we have close to 1 million displaced people who have come into Goma from the surrounding provinces due to the ongoing conflict. And this displaced population live in dire living conditions, very closely together with no access to clean water. And of course, if the virus were to spread in this population, it would be potentially catastrophic. So the news of the vaccines arriving today, that's good news for sure. It's a tool that we need in this response. That said, it's as so far, it's quite insufficient, the number. Let's hope that more will come. And then, as you say, it will be logistically challenging to get these vaccines out. But we, as Doctors Without Borders and other actors, we are also used to those challenges in this country. So I think it's not necessarily the logistics that are the most challenging. It's more the number, the accessibility of the vaccine themselves.
According to some reports, the Mpox is spreading more than twice as fast in children as in the general population. I wonder if you can tell us why that is and how concerning that is for you.
I think it's important to understand that this new variant of the Mpox virus is new. So there's quite a lot we don't know. Not Doctors Without Borders, not WHO, not the Ministry of Health, and not the population themselves. It seems to be spreading more easily between humans, and it seems to be more affecting children under 15, or they are more at risk when they contract the virus to die from the virus. But the data is so far quite insufficient due to low surveillance and also quite a lack of lab capacity to actually confirm the cases. So as of now, we don't really know how the situation is, but for sure it is of high concern, and that the vulnerability is within children and specifically also pregnant women and people living with lower immunodepressive people living with HIV, for instance.
Right.
Sorry. So for those population, we are specifically worried.
I wonder if you can just sort of broaden this out for us a little bit. I know you're focused on the DRC and Goma, but globally, how much of a concern do you think this is?
I think that this is specifically of concern in DRC and in this region where also the health systems are weaker. I don't think the rest of the world should be have a great worry because it is possible to contain the virus and stop transmissions in societies where we have access to health and strong health systems. So I think we should focus on the vulnerable population living in this part of the world, and also not to forget that they already have a full range of challenges to begin with, even before the Mpox. This is a very vulnerable population, as I said, up to 1 million people displaced, and they are worried about also other diseases like cholera is endemic, the rainy season is coming, measles, just to survive the next week because of the lack of food and clean water. And other health issues is already of big concern for this population. So the situation is really complex for the people themselves, first of all, but also for us to try to help them.
Okay, understood. Thank you so much for speaking to us from Goma.